29th of October. Today is World Stroke Day.
The superhero show, superhero show. Fever 104, turn up the radio.
Namaskara, tea coffee aita. Sriram Sulya on the radio here. Thank you for locking on to Fever 104 FM. 29th of October observed as World Stroke Day. To understand the serious nature and high rates of stroke, raise awareness of the prevention and treatment of the condition, and ensure better care and support for survivors. To help understand this better, I've invited on the show from the Department of Interventional Neurology from Narayana Health City, Dr. Vikram Huded. Welcome, doctor. How are you?
Hi, Sriram. I'm good. How are you?
Not bad. Just trying to make peace with everything that's happening around us. It is the new normal, and people definitely want to listen to more and more doctors on the radio. After all, you guys have been at the front line of things, so thank you for everything, doctor. But today, I'm specifically going to be talking to you about World Stroke Day. Today being World Stroke Day, I want to ask you, how exactly can one spot or identify a stroke?
So, stroke, we need to know the symptoms of stroke. We need to remember a mnemonic by name B fast.
Be fast.
B for balance issue or loss of balance. E for eye vision, either blurred vision or double vision. F for facial asymmetry, like if you smile, one side of the face goes to the other side. A for arm weakness or leg weakness. S for speech difficulty or speech disturbance. T is for time to rush to stroke ready hospital. So if you are having these symptoms, if you are seeing anyone others are having these symptoms, then you need to rush to a stroke ready hospital.
Well, we need to keep this in mind. We need to remember this. And most often than not, a lot of people do believe that, hey, this can't affect me. This is something that is not going to happen to me. But I think over the last few days, COVID-19 has been such a leveler. We need to be prepared for any circumstance. Be fast is a mantra that we need to remember when it comes to identifying or spotting a stroke. Stay tuned to Fever 104 FM. We're going to come back and talk about how a stroke is preventable with Dr. Vikram Huded. Also, save this number because this could help save a life during the time of a stroke, as time is of essence. 1-800-4250-4250. It's quite simple. 1-800-4250-4250. Back with Dr. Vikram Huded. Stay tuned.
The superhero show, superhero show. Fever 104, turn up the radio.
Dr. Vikram, I really appreciate you spending time with us and breaking things down, making it all the more simpler for a layperson like me to understand this. Say, is a stroke preventable? Can this be prevented in one way or another?
Stroke is a preventable condition also. So we need to know the risk factors, and those risk factors we need to control. For example, the commonest risk factor is high blood pressure. So we need to check our BP and control it. If you're having diabetes, that needs to be controlled. If you're smoking, you need to stop smoking. You need to do regular physical exercise at least 1 hour a day. And we need to eat healthy food, maintain the weight, avoid stress. And if you have any block in the blood vessel to the brain, we need to correct it either by surgery or by stenting. And if there is any rhythm disturbance in the heart, that also needs to be corrected. With these, we can prevent stroke.
Off late, we've been having so much of time at home. We are not really getting the kind of physical activity that probably we used to get at one point of time. So it's all the more important for us to take the effort of doing that physical activity, exercise daily. And for all the smokers out there, I guess that's the first thing that anybody is asked as soon as you visit a doctor, right? Do you smoke? Do you drink? It affects someone that very much. Doctor, before we wrap this up, I've heard of the golden hour, how time is of essence. How can one go about taking care of himself or herself after a stroke?
Okay, if you're having a stroke, you need to rush to a stroke ready hospital. If you come within 4.5 hours, there are clot buster injections which we can give. Or if there is a large vessel occlusion, some patients up to 24 hours, we can go inside the blood vessel and remove the clot out. So after this, we need to give medications as advised by doctor. You need to follow the doctor regularly. Risk factors needs to be controlled. You need to do physiotherapy and rehab. All these things, options are available for stroke. So you need not worry even after stroke. We can prevent further strokes, and we can give medicines to improve the present stroke also.
Save this number because this can help you save a life. It's 1-800-4250-4250. Number once again, 1-800-4250-4250. Dr. Vikram Huded from the Department of Interventional Neurology from Narayana Health City. Thank you so very much for spending time with us, and I will always remember, be fast, make sure that we take preventive measures, take care of our health, our body, and of course the readiness when a stroke happens is something that we cannot really underestimate. Doctor, any final thoughts?
Yes, stroke is a preventable and treatable condition. Don't worry too much about the present condition. You need to control your risk factors, mainly blood pressure and diabetes, and enjoy life.